Hi everyone. So following on from section 3, an introduction to the skeletal system, welcome to section 4, all about the joints. So what I'm going to do is screen share and we can all go through this together. Here we go. Share. Make this bigger. Okay, here we go. So section 4, again, is all about the joints. So we need to understand the different joint categories, okay? The majority of the learning or the understanding that you will need to remember is about the synovial joints in particular. But you need to be aware that there are other categories of joints. So you're going to be able to describe the different joint categories. Again, pay close attention to the verbs that are used. 4.2, you're going to explain the structure of a synovial joint. So remember, when you're explaining, you've got to give reasons for. So when you're explaining a synovial joint, you would say stuff like, within the synovial joint, we find synovial fluid. The fluid is, the purpose of the fluid is this and this and this, and it's there to do this, okay? Rather than just trying to describe what the fluid is, you're giving it a reason for being there, okay? You'll describe the joint actions at the major joints. So what's available at the shoulder, what's available at the elbow, the knee, the hip, etc., etc. You'll explain the characteristics of ligaments, so what the ligaments are made up of, and again, the reasons why they look the way they do, and similar for tendons. Let's go! Okay, so your introduction. So what is a joint? A joint is a coming together of one or two, coming together of two or more bones. And it's where these bones may articulate. Articulate is a posh word for moving. So you can see the examples we have on my left, spine, in the middle, skull, and then on the right-hand side, we have a picture of a foot. And again, these are symbolic for the different categories of joints that we have. So what you need to know is some bones or some of these joints are fused together where they create no movement at all. And again, a good example is the skull. So you can see in the picture, we have these what's called sutras, where we have these little lines that make up the skull. So when we are babies, these sutras are really weak. So these bones do move around or can move around as almost as plates. And as we develop through adolescence or through juvenile adolescence, then these sutras become more rigid and therefore they become less movable. Also, some of these bones are not fused, but some provide lots of movement and some don't. Within our spines, within the vertebral body, as you can see this, these are semi-movable joints. So we have a vertebrae and a vertebrae, and in between we have the intervertebral discs. So most of you will have heard about discs, prolapsing, bulging, etc. in our spine. So the discs are connected to the bones. They're not just kind of just sandwiched in between. They're connected through cartilage. And again, the movement here is fairly minimal. The movement looks great when we bend forward and we extend backwards. But that's a total sum of movement based on potentially 26 joints. Whereas if you look at the actual movement in isolation per joint, it's fairly small, if that makes sense. So classifying it, we have 3 different categories. So we have immovable joints, and this is what we call fibrous. And again, the example that we generally use that you find in textbooks is the skull, where these sutras meet. We have cartilaginous joints, and again, these are semi-movable. They provide some movement, but not a great deal. Good examples are the spine, so in between these vertebral bodies, so these bones, our vertebrae, and also stuff like our sacroiliac joint, which is the coming together of our pelvis and our spine. Again, most textbooks that you read will give you the vertebrae as a semi-movable joint. And then we have synovial joints. And synovial joints are the most common joint that we have in our body. It's found in most other joints. And they are freely movable, which means they provide degrees of movement. Some synovial joints provide lots of movement. Other synovial joints provide some movement. Okay? So your classifications of joints are fibrous, cartilaginous, and synovial. Fibrous don't move. Cartilaginous provides some movement. Synovial joints provide degrees of movement. Okay? This will definitely come up in your exam, by the way. So let's dive a little bit deeper into these freely movable joints. So I'm going to come back to them last couple of slides. So synovial joints. This is a real common joint within the human body, and it's something that you need to know the structure of. So remember, one of the learning outcomes was to be able to explain, not describe, explain the structure of a synovial joint. So joints, remember, is the coming together of two or more bones. So let's say, use this example, the picture, let's say it's a knee joint. Let's make it nice and easy. So within the knee joint, so this bone at the top would be your femur. Again, we're getting to names of bones. Would be your femur, which is your thigh bone. And then you have your shin bone, named tibia. So at the end of all of these bones, we have what's called articular cartilage or hyaline cartilage. Okay, again, you will definitely need to label this in your worksheets, and it will come up in your exam, no doubt. Okay, so your synovial joint structures are, so the hyaline cartilage, if you were to explain the articular cartilage, it is a soft surface that sits on the ends of every bone, so the bottom of your knee, bottom of your femur, your thigh bone, and the top of your shin bone. The purpose of this structure or this material is to create a softer surface so we don't get this bone on bone banging. Because if we have that, then over time or through impact, we will create some level of degenerative changes, so damage. And that's often described as osteoarthritis. So the main purpose of the cartilage is to absorb some shock and act as cushions. Okay? It's fairly strong material, although smooth, it's fairly strong material because it's there to protect the bones. So we have ligaments. Within the knee, you have 4 main ligaments. One on the inside, one on the outside. 2 that sit kind of at the back, ACL and PCL, the cruciate ligaments. And the purpose of the ligament is to attach bone to bone. And they're there to stabilize joints, okay? They provide real structure and they provide stability to allow some level of movement, but really to manage and limit movement. So within this joint, we have a capsule, almost like a balloon that sits around the 2 bones. And again, the purpose of the capsule is to hold everything together. So we have a fibrous capsule. Fibrous is real tough, strong material. And again, the purpose of it being fibrous is to create some rigidity, to create some level of stability and compression within that joint. So within the capsule, or underneath the fibrous capsule, we have a membrane, a synovial membrane. And a membrane, as we know, as a generic term, is there to hold stuff in as well. So the membrane holds in this synovial fluid, and the fluid sits within the joint cavity. It sits in the space. And again, it secretes this lubricating material, which is your fluid. So it allows fluid to seep in to lubricate the joint. But again, through impact, through wear and tear, or even as the day progresses, we just lose some of this fluid because of these compressive forces, which is fairly normal. Okay, and again, the purpose of the fluid being there is to allow lubrication for nice, smooth movement. Okay, so again, within your worksheet, you'll be asked to label some of these joints. And some of the labeling is fairly simple. You don't need to be particular to what bone it is because we don't really know what joint we're looking at. So we have bone. It might be a bit more particular. And as you can see on this diagram, it's got the term, the periosteum. The periosteum, again, as you should know from section 3, is the outer layer of the bone, and it creates this connection between bone and other soft tissues. So it's the outer layer of the bone. So you may be asked to label the periosteum and not just the bone. So again, we have these muscles, and the muscles attach into the bones via tendons, okay? And again, we'll get onto the structure of tendons and the purpose of it. You have a joint capsule, and again, within that joint, underneath the joint capsule, you'll have a synovial membrane. Within the joint, in that space, sits synovial fluid. On the ends of each bone is you have articular or hyaline cartilage. Okay? So just again, remember, when you're asked to explain what these things are, you have to say what it is, what it's made up of, and why it's there. Okay? Give it a purpose. So, types of synovial joints. You need to remember six synovial joints. Remember, the synovial joints are the freely movable joints. These are the ones that we'll find generically around the body that give levels of movement. So the first one for you to remember is the ball and socket joint. So the ball and socket joint, again, as you would imagine, we have a ball on the end of our bone, and then another coming together of bones creates a socket. A really good example of this is the hip. So we have examples here, hip and shoulder. So if I unshare my screen, if I can, stop the share. What are we doing? So the quality of my camera isn't perfect, so bear with me. So, as you can see on the diagram, a really good example of a ball and socket joint is the hip, because you have a very obvious ball and it sits in a pretty deep socket. So within the pelvic girdle, we have this acetabulum, that's a posh word, for the femur or the neck of the femur, or the head of the femur to fit into. So your hip joint is a real stable joint for that reason, because the structure of the joint, again, is really closed. We have a very obvious ball and socket within here. It provides lots of movement, and that's the purpose of a ball and socket. But again, the hip joint is, generally speaking, a real safe, sturdy joint. When we compare a little bit higher to the shoulder, so again, it looks real different. So we have a real obvious ball that sits on the top of our humerus, so our arm bone. But you can see the socket is pretty poor, actually. It's not that good. So the socket with regards to the shoulder is the coming together of, the shoulder blade, which creates this real shallow socket, and then your collarbone, which kind of puts a bit of a lid on the joint. So the purpose of the shoulder joint, again, ball and socket, so provides lots and lots and lots of movements. It's a real shallow joint, which creates way much more movement. However, the big difference between shoulder and hip is we have lots of shoulder injuries, again, because it's very difficult to allow lots of movement going on and to have lots of stability. So again, the compromise here is lots of movement versus a lack of stability, which is why lots of people have shoulder issues. But again, it's another example of a ball and socket joint. If I go back to the screen, here we go, share. Oh, I've lost it now. My bad. Let me catch up. Okay, so again, when you're looking at the structure, this is what you've got to try and discuss. You've got to add some detail in the shape, the size, and why you think it fits this description. So you have a hinge joint, is your second synovial joint, commonly found in the knee and the elbow. So again, the elbow is a perfect example of a hinge joint in that it's a coming together of two, in this case, 3 bones, humerus, radius, ulna. Again, you should know these by now, hopefully. And the movement is flexion, extension. Again, we'll go over the terms and what they mean. Flexion, we shorten the angle. Extension, we create a bigger angle within the joint. So again, the elbow joint is a real true hinge joint in that it only goes backwards and forwards like you would imagine a hinge on a door maybe would do. The knee is also an example of a hinge joint at this level of understanding. So at level 3, we're saying that the knee is a hinge joint. But as we progress through levels, if you desire to, we might find that the knee doesn't necessarily fit perfectly into a hinge joint, because at the knee, we have some level of rotation as well. But for now, the knee is a hinge joint for you, okay? Synovial joint number 3. What am I doing here? Number 3 is the pivot joint. So as the example shows, the purpose of a pivot, anyone friends, is to have an axis, and we're going to call this an atlas, this one here, and we create rotation, and rotation only. And again, good example. So the atlas and axis refers to this here. So this is a spine. So we have C1. So the spine, as what you should know by now, we have the cervical spine, which is our neck area. C1 is this atlas. So it's the very bottom of our skull, and it sits on top of C2. Where's the camera? C2, which is what we're going to call the axis. Okay, and the only movement potential here is rotation. Okay, so when we have rotation of our head, lots of that movement comes from the atlas and the axis. So whenever you're reading text online or within the book, and it refers to the atlas and the axis, that's our C1 and C2, the very, very top 2 joints of our neck. And that's the only place you'll find this pivot. Okay. Synovial joint number 4 is our saddle joint. Again, saddle joint, a common example used is our thumb. How are you doing? So carpo-metacarpal joint. And again, it's got the saddle joint for the shape and the size of it, and one bone sits on top nicely on top of the other one. There is limited movement here, so we only really have flexion, shortening the angle, extension, and we have abduction where we take away. Adduction is where we add the joint back towards the plumb line. Okay, flexion, extension, abduction, adduction. So the saddle joint, something to remember. And again, the example that you should be providing is at this carpo-metacarpal joint. So pretty high up on the thumb joint here. Okay. Number 5, gliding or sometimes sliding joint. The example provided in this PowerPoint is the acromioclavicular joint, or the AC joint. So the AC joint is where your collarbone meets your shoulder blade, your clavicle and scapula. So again, we call it a glider or a sliding joint is because it doesn't hinge, it's not a ball and socket, it's not saddle. It provides this level of movement. So this kind of gliding or sliding where we articulate kind of up and down, left and right of each other. Another example is tarsals or carpals. So you can see these bones within the foot, these cuboid shaped bones. Again, they're kind of like locked in against each other. But again, the purpose of every joint, every synovial joint, is to provide some level of movement. So here, we just get this gliding movement where the bones kind of just move across each other, up and down, left and right. Okay? So, prime example is the AC joint, the acromial, this, and the clavicular, the clavicle. They're coming together here. If you're ever asked for additional examples, then carpals, tarsals, so hands and feet, where we get these cuboid shaped bones and They move across each other, glide and sliding. Okay. I forget where we are. 6! Synovial joint 6! So we have the ellipsoid joint. Again, often forgotten. So where we would find this is the metacarpophalangeal joint. These are posh words. So a little bit further down from where we suggested the thumb was. So we have the metacarpals. There we go. Here, where it meets the phalanges, which is the extension of our fingers. So these end bits. So again, here, the ellipsoid, similar to the saddle, is that they don't provide a great deal of movement. They're often compared to a ball and socket in terms of the movement created or the movement allowed within these joints. I don't know if you can see that very well. So we have flexion, extension, a little bit of adduction, some circumduction. So this part rotation, but we don't have true rotation to these joints. But again, mainly flexion extension within this joint here. That's what we use it for. But again, we have other movement available really for safety, right, before we snap some of these joints. So that was synovial joint number 6, the ellipsoid. So remember, when you're asked to describe some of these joints, you're looking to give detail about shapes, provide examples, and then you will no doubt be asked to provide detail associated to what movement is available there. So for now, what we need to know is classification. So there are 3 classifications. Again, you have bones, joints that don't move, joints that move a little bit, joints that move a lot. You'll need to know so far the structure of a synovial joint. You'll need to know there are 6 examples of synovial joints found and where we find them, okay? For now, we can keep them separate, but as we progress through the course, you should be able to say with some confidence, the shoulder joint. The shoulder joint is the coming together of the humerus, the arm bone, the clavicle, and the acromion, so the scapula. It's a synovial joint. Within the synovial joint, we have the ends of bones that have this articular cartilage. We have a fibrous capsule. Underneath that, we have a synovial membrane. Within the membrane holds synovial fluid. The purpose of all of this is to allow nice movement. Within the shoulder joint, it's a ball and socket, as we say, and it provides a big range of movements. The ranges of movement available are flexion, extension, abduction, rotate, external, internal rotation, blah, 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 blah. You should be able to provide that level of detail as the course progresses, okay? So, again, I just put this here. Your job for now, again, is just think about different joints in the body. Go knee, go elbow, go shoulder, go ankle, and have a think about what type of joint it is. If you're unsure, again, your job is always not just listen to me babbling on a load of nonsense to you, and not just use your manual as your only source of information. Please don't do that. I was thinking last night about what I want from this course. So what I want for you lot is, I've said this in emails, I don't just want answers. I want you to have a certificate at the end of it to justify your level of learning. I don't want you to pay money to get a certificate. I want you to pay money for you to learn stuff. And as a consequence, you get your certificate. So remember, it's about your learning. It's about your own development. I want you to be able to, at the end of the course, be a confident, competent practitioner. So, which means do your reading, learn yourself. And again, my job here is to help, support, facilitate, encourage. But lots of this has to come from you. Okay, joint actions. Okay. So the joint actions refers to what movement is available at certain joints. So the good way for you to learn this sort of stuff is to couple them. Most of these words that you can see on this list right now Most of these words come in pairs. So if you have one joint action, you will no doubt have the other because it's the opposite direction. So for example, flexion, to describe flexion, you would describe a shortening or a reduction in the angle at the joint. Okay, so at the elbow joint, it's a hinge joint coming together of humerus, radius and ulna. And as it flexes, we reduce the angle that's available at that joint. If we have flexion, we of course have the opposite, which is extension. Okay, so to help you learn, you don't have to learn individual words, learn them in pairs if you can. So flexion, we reduce the joint, reduce the angle at the joint. Extension, we increase the joint angle. Okay, flexion, extension. And we have flexion extension at most joints. So, flexion at the elbow, extension at the elbow. Flexion at the shoulder, extension at the shoulder. So we reduce the angle at the front through flexion, we increase the angle at the front through extension. Okay? Same at the knees, at the neck, so cervical joints, flexion, reduce the angle, extension, increase the angle. Lumbar spine, leaning forward, flexion, bend backwards, extension. Again, we'll go through all this together as a group so we nail it. But again, your job is make it as stupid or as daft as you can, even when you're waiting for the kettle to boil, then go through these joints, flexion, extension, flexion, extension, flexion, extension. Then your next couple is abduction, abduction, and adduction, adduction. Okay? The term to abduct would be to take something away. So again, we have abduction at our shoulder. So we can abduct, we can take our arms away from our body, abduction. And of course, if we have abduction, we have adduction. So we're adding our limbs back towards the plumb line, so the middle point. Okay? So abduction, you take it away. Adduction, you add it back. That's your next pair. Abduction, adduction. Also found, how are we doing? Commonly at the hip joint. Ab, so AB, so we abduct, we take it away. And of course, if we take it away, we can add it back. Abduction, adduction. Abduction, adduction. Abduction, adduction. Ba, 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 ba. Okay? Your next couple is plantar and dorsiflexion. I have no idea why we just decided to change the term just to spice things up. So plantar and dorsi can only be found at your ankle joint, okay? Plantar, meaning we plant our toes. So we're going to plant our toes down, which creates this pointing of your toes. Camera's not there. Plantar, dorsi. Plantar flexion, dorsiflexion, only found at the ankle. Plantar, you're planting your toes down. Dorsiflexion, you're pulling your toes back up. Only found at the ankle. Plantar, dorsi. I'm going to skip a few. So for now, I'm going to skip rotation, skip circumduction, skip lateral flexion, because they come in isolation of each other. So your next couple is pronation and supination. Again, only found for now at our wrists. A way for you to remember it is, or the way I always remembered it, I'm having a nightmare with this camera. Supination is palms up because that's how you would hold a soup bowl, as daft as that sounds. So hold your soup bowl is supination. And of course, if we have supination, we have pronation. Supination is palms up, hold your soup bowl. The opposite of supination, palms down. Palms up, supination, palms down, pronation. Supination, pronation. When you're describing it, use the example at the wrist. Supination, pronation, supination, pronation. Okay? Your next couple, you're gonna dive back down towards the ankle, where we have inversion and eversion. So, I always get these two mixed up. For your reference, Eversion is this, where we turn our sole of our foot to face in. Inversion is where the sole of our foot turns out. Inversion, eversion, inversion, eversion, inversion, eversion. Sorry, 2 seconds. I've actually said that wrong, you know. My bad. Again, I get that mixed up all the time. Inversion is where, can't believe I got it wrong, is where we turn our foot in. So the sole of our foot faces inwards. Sorry. Inversion, so this would be an inversion injury if we were to roll our ankle this way. Eversion, the sole of our foot faces out. Inversion, the sole of your foot facing in. Eversion, the sole of your foot faces out. So there's your next couple, is inversion and eversion at the ankle. So if we climb back up the list a little bit and go back to rotation. So again, the rotation is a nice simple one. It just suggests something rotate. And we can have rotation in a couple of areas. We have rotation, of course, as you now know, at the what joint? Pivot, pivot. So where the atlas meets the axis, okay? And again, we find it at C1 and C2, where our head sits on top of our neck. So we have this rotation. Also, we have rotation in what other joint? Whoosh, ball and socket joints, that's right. So the ball and socket joints are where? Shoulder and hip. So again, at the shoulders, we have internal rotation, external rotation. Internal rotation, external rotation. External being we are rotating it away, internal rotating towards again. Same at the hip, ball and socket joints. We have external rotation, internal rotation. External rotation, internal rotation. And again, it's really important to know, as the course progresses, it's really important to know what movements are available at the joints. Because when we start talking about muscles and what movement a muscle creates, then we're basically tying these together. Because joints don't move by themselves. These bones don't move by themselves. That you have movement in a joint. And a joint, again, as you know, is a coming together of two or more bones. But these bones move through muscular contractions. The muscles pull on the tendons pull on the bones, the joints move. So again, as the course progresses, we'll be able to tie up these, so it just makes much more sense, but there's much more detail to learn. Circumduction, again, it's a weird one, circumduction, in that it's not quite rotation, but it looks like things are rotating. So again, a good example of circumduction is, if we kind of just let your arm dangle, and this happens. So in terms of rehab, the only time I would use circumduction is to try and create some joint space. Well, we're pulling these arms, basically you're trying to open the space within the synovial joints. We're trying to pull the membrane away from each other, or stretch the membrane to increase the fluid that goes in. So circumduction is this circular type movement around a bone, but it's not rotation. Then your last standalone movement is lateral flexion. And again, lateral flexion is not specific to in or out or up or down. The perfect example of lateral flexion is at the trunk, so the lumbar spine, thoracic spine, is we have lateral flexion to my left, lateral flexion to my right. Okay, rather than being medial, lateral, or internal, external, it's just the same. It's lateral flexion to my left, lateral flexion to my right. Okay? For this level, for this course, they're your joint actions. Again, your job is to repeat. Repeat these all the time. Try and get your head into what's available, what am I doing with my arms? So every time you move your arms, move your legs, what movement am I creating around what joint? Whether it be knee, ankle, hip, trunk, head, neck, whatever it might be. what movement am I creating from what joint, and what type of synovial joint might that be? Okay, so remember, if I do this when I'm waiting for my kettle to boil, the thought process through my head is I'm creating rotation. I think most of the rotation is coming from a synovial joint at the neck. It's most likely to be C1 and C2, which is our pivot joint. The movement around the pivot joint is, of course, rotation. Okay, so again, your thought process, you're going to try and tie some of these together. Make sense? Bloody hope so. Okay, so again, try and test yourself. What movement is available at the hip? What type of joint is the hip? Give me a second. So hopefully you are stood up and you are moving your leg, your hip around. Okay, so please do this with me so I don't look like a total divvy all by myself. So let's talk about the hip. So the hip is what sort of joint? Yes, you are correct. Hip is a ball and socket joint. The purpose of a ball and socket joint is to provide lots of movement. The hip is a great ball and socket joint because the ball fits into a nice solid structure of a socket. So it provides lots of stability and a decent degree of movement. So what we have here is flexion. So we're reducing the angle at the front. Flexion of the hip. And of course, if we have flexion, we have, what's the couple? Extension, flexion, extension of the hip. Flexion of the hip, extension of the hip. And again, to give you a little bit more context, most people have decent flexion of the hip because this is our sitting position. We sit lots. If you have a job or if you come across a client who sits for a living, often they have decent flexion, but they have poor extension because they're kind of locked into this shortened position on the front. So their ability to extend, their ability to take their leg behind their body in relation to the hip joint is often compromised. Sorry, I digress. So flexion, extension. We also have, what is this? Where we take something away. Please at home be saying abduction. And of course, if we couple that together, if we have abduction, of course we have adduction. Okay? Also, if I do this, and I rotate it away, we have external rotation. Of course, if we have external rotation, we have internal rotation. External rotation, internal rotation. Okay? And again, if you really wanted to, if I dangled my leg off a box or something, I could create some level of circumduction. Okay? Shoulder follows a similar pattern. The elbow, and again, nice, simple. The elbows are coming together of, come here, pal, all best. Humerus, radius and ulna. More so the ulna than the radius. Again, you should know, or we will know, the radius kind of sits on the side of the ulna and it spins on the edge of it. So really the ulna and the humerus coming together, it's a synovial joint because it creates movement. What type? Hinge. It's a hinge joint. And again, hinge joint provides only limited movement. At hinge joint, we have shortening of the angle, flexion, increasing the angle, extension. Nice and easy. So again, please test yourself with wrist, knee, ankle, atlas and axis. Okay, let's move on. So you need to know or explain ligaments and tendons. So a ligament, as we said earlier, a ligament connects a bone to another bone and it crosses a joint line. The purpose of ligaments is to stabilize joints. It's to keep these bones together to allow some movement, but it's to manage the movement, to provide some movement, but to limit the movement. Again, if we didn't have ligaments, we would have no stability and no support, and we're asking our muscles to do far too much to do that. Anyone on this course who's been active, it's likely that you have done some level of damage to ligaments, whether it be ankles or knees. Okay, in terms of structure, your ligaments are made up of collagen and elastin. So again, when you're asked to describe or explain, it's important to know these materials. So collagen is thick, fibrous white material. And again, it's there to provide some rigidity, some support within that tissue. But we also have elastin, which is a little bit more flexible, so it allows these ligaments to extend, to stretch slightly, because again, we need some level of movement around joints. If we didn't have any movement around the joints, things would just snap. So again, the collagen is there to provide support. The elastin is there to provide some level of flexibility. They are white in color. So if we cut your skin open and have a look at it, they're white in color, which means they have a pure blood supply, which means in terms of recovery, it takes time. Okay? Tendons. So your tendons, again, kind of similar to the ligaments, but the tendons connect a muscle to a bone. So we have more collagen fibers. Why is that? We have more collagen fibers within the tendons because we have muscles that are pulling on the other end of the tendon, and muscles contract, so they pull on the tendon, which pulls on the bone, which creates the movement. So in here, for example, we have the bicep muscle, and we have a bicep tendon that crosses the elbow, crosses the joint line, and attaches to these bones on our wrist, forearm. So when the bicep contracts, it pulls up towards the origin. Again, you need to know this as the course progresses. Pulls up towards the origin, and it pulls on the insertion and creates this movement. The reason that we have more collagen fibers within tendon is because, again, you've got something that's constantly pulling on it. So the tendons need to be robust, they need to be strong, they need to be stable so they don't break down. Okay? They have a shiny white appearance, again, just based on the fact that the material is more so collagen. And they emerge from connective tissues of the muscles. So when we talked about earlier, the layers of bone, the structure of bones, so the outer layer is the periosteum. Again, the periosteum being the outer layer. And what we now know, and again, this is going beyond this course, we now know the periosteum. We used to kind of think of it as like an eggshell, like an outer, like rigid structure. But we now know a little bit more about the periosteum, that it's a bit softer surface, and it isn't that we have a tendon just stuck to a bone. The tendon kind of blends into this material that overlaps the bone, which now we know is the periosteum, which almost makes the bone part of the tendon and the tendon part of the bone, if that makes sense. Rather than having two separate structures, tendon and bone, they kind of blend into each other. The purpose of that is for things to almost to be seamless. So if you just kept pulling on my jumper, it's likely to tear or damage where the stitching is, because there's a very, very clear or obvious disconnect between the material that makes up my arm and the material that makes up the body of my jumper, if that makes sense. Whereas the human body, we now know it's a little bit more seamless than what we originally thought. Okay, I hope that makes sense. So for now, you should be able to describe the different joint categories. There are 3 joint categories. You should know them. You should be able to explain the structure of a synovial joint. And remember the verbs. When we're explaining, you have to give reasons for. So you have to say there is synovial fluid within the joint capsule because. If you end most sentences with the word because, it forces you to deliver more information. It forces you to support what you've just said. So try and crowbar in because. And generally speaking, if you don't, then my question would be, well, why? And most responses to why are, well, because. So rather than me say why, then you just get the because in early. Okay? We have a joint capsule because. We have this articular cartilage on the end of our bones because. Okay, so remember that. When you have explained, you have to give reasons for. So the joint actions are the major joints. Again, your job when you're learning it is try and couple them. Flexion comes with extension. Abduction comes with adduction. Plantar flexion comes with dorsiflexion. Supination comes with pronation. Inversion comes with eversion. And then you've got your standalone rotation, lateral flexion, and what was the other one? Can't remember what the other one was standalone. Circumduction. Oh, not on that list that you need to know. Sorry, not on that list is elevation and depression. Elevation and depression. Elevation clearly meaning things move up. Depression coupled, obviously, if something moves up, then it can move back down. Elevation, depression. Good example is at the shoulder joint. Elevation, depression, or not so much shoulder joint, but it looks like a shoulder movement, but it's a scapula, so shoulder blade moving up and down. Also in this area, you have retraction, where we're retracting, so bringing things backwards. So we're bringing our shoulder blades backwards towards themselves. And if you have retraction, you have protraction. So again, this is another couple. So we retract, bring things back together. We protract is where, again, often people sit slumped, and that's protracted shoulder blades. So protracted shoulders is where the shoulder blades kind of just get pulled around. Okay, so elevation, protraction. I think that's everything. Explain the characteristics of ligaments. Again, you need to remember the purpose of a ligament is to attach bone to bone. It's to create some stability around the joint to allow some movement, but to manage the movement for support. Your ligaments are made up of collagen and elastin for this reason and that reason. And again, when you're going into tendons, make a clear difference between, make a clear, what am I trying to say? Description or explanation, sorry, clear explanation of how your ligaments and tendons differ. The tendons, again, come from muscles attached onto bones. They blend into the periosteum. There's less elastin in the tendons because this reason and this reason. Okay, so I'm going to upload this for your perusal. But again, your job is to use these pre-uploaded videos, use your course manual, then do some more reading around it. I want you to be good at the end of it. I don't just want you to be okay and just passed. But that comes from you. Okay? All best. Stop the share. And pause.